everybody. Karen Roby and Tiernan Ray here for ZDNet. We're talking today about how AI, artificial intelligence, is being called upon to help here in the drug development world for COVID-19. And Tiernan, I know you said you've had a really great response to this article. Obviously, people are really clamoring for information. You know, we're all hoping a vaccine can be found sooner than later, and any information involved in that, people are really looking to learn more.
You know, Karen, there's a glimmer of hope coming from the Department of Energy's Argonne National Laboratory, which is just outside Chicago. It's one of the 9 DOE labs that has enormous computing power. And Rick Stevens, who is the Associate Director for Computing in Life Sciences and the Environment, told me that they're seeing some progress with some molecules that are showing some inhibition of the virus. And so this is one small step along the way to making a vaccine at some point.
That's excellent. And you know, as we were talking about here just a few minutes ago before we were on camera, it's, you know, pre-COVID-19, talking about starting from scratch in some ways to make some of these small molecule drugs, but this is a totally different ball game.
Yeah, they pivoted quickly to take some years of cancer research approaches and speed them up, Karen. They've got a new computer, a new kind of computer from this startup in Silicon Valley called Cerebras Systems, and it features the world's largest computer chip. And this was introduced last August. And the DOE's Argonne Labs was the first announced customer for the computer system called the CS1. It's about the size of a dormitory refrigerator. And it can run jobs that would take hundreds or thousands of either Intel CPUs or NVIDIA GPUs. You'd have to tie them together, you have to string them together, make one big supercomputer. Instead, they have this little pint-sized machine that can do all of that work in one fell swoop. And what it's allowing them to do, Rick Stevens told us, is they can iterate. When they don't have to set up a job to run on many chips, they can just try out lots of stuff with this really fast system. And so what they're doing is they're going through thousands of known drugs that have already, some of them already been marketed on the market and tested for safety, and then some sort of short list of molecules. I mean, it's long, it's 4 billion molecules, but it's smaller than the known universe of possible molecules if you were starting from chemistry. And what they can do is by jumping through these things, they can test a lot of possibilities, and they can cut through some of the early work of drug development where it's just chemists who are synthesizing something from scratch. And they can get some lead compounds, which they can then hand to scientists to test in vitro and ultimately in animal models. And so this drastically accelerates the pace of drug development to try to get to some vaccine.
Wow. And I mean, do you think that there is a chance that, well, a lot of things in our world are going to change, as we know, as a result of this pandemic and the way we do things, and, you know, innovating in different ways to make do here. Is there a chance that this will change going forward? You know, once we get past and a vaccine is found, when it comes down the road to other medications that are needed or other diseases that they're studying, could it change how they approach those?
That's a deep question, Karen. I think like work at home and homeschooling and things like this, a lot of people are starting to say, oh, this is the change from which you don't go back. There is an acceleration, is a term that people are excited to use. And no one can predict the future, but once you show that you can quickly run through things on a computer and simulate what used to be maybe laborious work of technicians in vitro or in vivo, then you start to say, wow, we can really speed up a lot of things if we just shove it into a big computer, simulate it, and then give the results of that to our lab technicians. So this may be an inflection point, a tipping point, however you want to term it, where there's an acceleration and that changes things permanently, at least in part, going forward.
Yeah, I'd say we'll see that on a lot of fronts. Well, finally here, Tiernan, was there any information given? Of course, they don't have a crystal ball and don't want to give a timeline out per se, but what do they expect could happen in the next coming weeks and months here with this?
First thing they're going to do is publish, Karen, so there'll be a lot more information about how they're developing these new models with this faster computer, things that people can replicate. But they've got 9 DOE labs, they've got tons of universities, UC San Diego, University of Texas, University of Michigan. They've got all these academic partners who are participating, all these people to coordinate, and they've got to take these simulations that they have on the computer, they've got to give them to scientists to test in vitro and then in animal models in vivo. So there's several steps of this, so they're very cautious, and the most that Rick Stevens would tell us is we're seeing some inhibition of the proteins of the virus, meaning some molecules that we've tested grab onto the virus and prevent it from functioning as it's supposed to. And that's a positive sign, but they don't want to get, too enthusiastic and raise people's hopes too much. So we have to wait and see what comes as all of this computer work flows through the laboratory process and gets tested in these other scientific settings and see what comes out of it. So watch for the published papers in peer-reviewed journals will be the next thing to look for.
All right, very good. Hey, any positive information like that is what we need, right now. So I'm sure you'll keep us posted on that, Tiernan, and obviously your full article, much more up on ZDNet there. And we hope all of you will check it out. Thanks for watching.